Avian influenza. Avian influenza is a respiratory illness found in birds. According to the USDA's Animal and Plant Health Inspection Service, avian influenza, or AI, is caused by an influenza type of virus. The APHIS outlines the two different strains of AI. Highly pathogenic avian influenza, HPAI, and low pathogenicity avian influenza. The highly pathogenic strains are the ones that poultry owners should be concerned about. The APHIS states that these strains are extremely infectious, often fatal to domestic poultry, and can spread rapidly from flock to flock. The Indiana State Poultry Association warns that this disease is so powerful that 1 gram, approximately 1/4 of a sugar packet, of contaminated manure can contain enough virus to infect 1 million birds. Contraction of avian influenza AI is most commonly spread directly from bird to bird. This happens through secretions of the respiratory system and via manure. The disease can also be contracted and spread when chickens come into contact with wild birds and other fowl that carry the disease. Another contraction method is from contaminated equipment, vehicles, clothing and shoes. Smuggling and illegal movement of some chicken breeds may also encourage the spreading of avian influenza. Symptoms of avian influenza. Some of the most common signs of AI include lethargy, trouble walking, lack of appetite, diarrhea, lower rates of egg laying, soft eggshells or misshapen eggs, discharge from the nose, coughing and sneezing. Chickens with AI may also have swollen heads, eyes, combs and wattles and legs. There may also be discoloration in the wattles, combs and legs. Birds with AI may sometimes experience sudden death for no obvious visible reason. Treatment for avian influenza. Prevention of avian influenza is the best cure. To prevent AI and other chicken diseases, biosecurity and rigid sanitation practices should be in place. Sanitation tips for AI. Prevent contact with wild birds. Keep rodents away from your flock. Wash hands before caring for chickens. Disinfect shoes in footbaths. Don't visit other farms or homes with birds. Temporarily isolate new birds. Restrict visitors to your farm. Treating AI is a little more tricky than with some chicken diseases. According to the Merck Veterinary Manual, antigenically matched and properly administered vaccines can prevent clinical signs and death and greatly reduce virus replication. However, as there are many different subtypes of the virus, it is important to use the appropriate vaccine for the strain in question. The Merck Manual also states that in some cases, broad-spectrum antibiotics may control secondary pathogens, and increasing house temperatures may reduce morbidity and mortality. Infectious coryza. Merck Veterinary Manual defines infectious coryza as an acute respiratory disease of chickens characterized by nasal discharge, sneezing, and swelling of the face under the eyes. Infectious coryza, also sometimes known as the chicken cold or chicken croup, is caused by a bacteria called Haemophilus paragallinarum. The poultry site also states that the condition is more commonly contracted in flocks that are held on multi-age farms and that never see complete depopulation. Contraction of infectious coryza. Infectious coryza is contracted through the conjunctival tissues of the eyes or through the nose. It can be airborne, transferred by direct contact with an infected bird, or consumed through contaminated water. Chickens with pre-existing respiratory conditions, such as viral or bacterial infections, may be more prone to the disease. Older roosters and hens are also more likely to contract infectious coryza, although it can be contracted at any age. Unsanitary farms and coops are a major factor in the spreading of the disease. Avian influenza. Avian influenza is a respiratory illness found